What the actual... job? Hello, I'm your host, Maya Fraser, and welcome back to What the Actual Job, where I interview individuals about their careers so that high school students can gain a better understanding of the jobs they'd like to pursue in the future. Today's interview is with Mutiat Sogbade, a nurse from the Ottawa Hospital.
So my name is Mutiat Sogbade. I'm a registered nurse at the Ottawa Hospital, the General Campus. And specifically, I work on the nephrology unit, where we look after kidney transplant patients pre and post-transplant. We also look after patients who are yet to have transplant if they're on the wait list and they're doing dialysis. While they're on the wait list for transplants, some patients with kidney failure, kidney diseases, they do dialysis.
That's really cool.
Taking of general patients, so, yeah.
That's really cool. I did not know that was like another niche. That's really interesting. What does a typical day look like for you?
It's a 12-hour shift, so 7:15 a.m. to 7:15 p.m. So typically, like I said, mostly it's in nephrology. You need to look after kidney patients with kidney diseases. We also have patients that maybe have sickle cell disease or other diseases, and sometimes the hospitals overflow and they just bring them to us.
Yeah.
But sometimes it's so busy that you barely have time for break, and sometimes it's like, okay, relax, like doing assessments in the morning, checking vitals, asking how the patient's been doing from the night before or from the day before, depending. It also depends on what you get or why the patient is there. Some patients are really like constant monitoring, like you have to keep an eye on them like every hour or so.
Yeah.
And some are like relaxed, like okay, they're getting better, they're just waiting on the social work trying to find them like a place to live or like trying to make living arrangements, Or like some patients are better, just they need to increase their functional mobility, like some due to the illness or the diseases, they kind of become like their muscles have become weak. So it depends on the nature of the patient's illness, and it also depends on how many patients I have.
What do you like most about your job, and what makes you want to come to work every day?
Because I like working with my colleagues. I love people I work with. Usually the way the hospital is, the way it's scheduled is that everyone has a group that you work with. I like people I work with.
That's great.
Sometimes I'm just looking forward to go to work so they can make me laugh and then we gist and then that's really, I really look forward to that. And also, the fact that you go to work and then okay, I'm going to make a difference today, or you do something for someone. I know it doesn't come often, but you hear people, so thank you very much. I mean, maybe saying thank you is just a matter of courtesy, and some really show appreciation, which to me makes it's a big deal. And also, you help somebody, especially when you had the patient before, and then the next time you're coming in, you have the same patient. Oh, you were here the last time, yeah. So why are you here? Oh, I just had this. Then okay, this patient is getting better, or okay, in some kind of way I've contributed to this patient getting back on their feet, going back to their normal life. It is something.
That's really cool. Yeah, that sounds really great, especially hearing it from the patients themselves that you're really, making a difference. That's great. What's the hardest part about being a nurse in your field?
Like I said, on my unit with people with kidney diseases, and then you find someone is at like in their prime maybe, because when I find people like youths or the people who are not so old and have kidney diseases, they're already young, like in their 30s or 40s even, they are just stopped to having dialysis their whole life until they're able to get a transplant.
Yeah.
Also, there are some people that I will see have had patients who have been on the wait list for long, and instead they're not finding their match, or they're on the wait list and then they die, or they've been too long on the wait list. Another thing, I've had a couple patients where they've been on the wait list and then they call them in saying, oh, you can come, we have a kidney for you. And the patient coming, with such enthusiasm, with such, hope for a new life, okay, things are going to get better with me when I get my new kidney.
Yeah.
And then they come, and then something happens. It's either, like their blood pressure just goes over the roof, or something happens, and then you have to tell them, oh, sorry, we cannot go through with this surgery. the disappointment, the pain that comes, oh my goodness, again, then you have to go back on the list. And also, I've had patients where they got the kidney and then they have to come back even after the surgery because they're having like recurrent infections or their body's trying so hard to reject the kidney.
Yeah.
It's a lot of things. It's not from the outside. Oh, we think, okay, once I get the kidney, that's fine, and then life goes back to normal. No, it doesn't work like that.
Yeah.
Like some people, they get the kidney and then their body rejects it so badly that it affects another of their organ, and then they have to make multiple visits to the hospital. Eventually, I've had people, they had to remove the newly transplanted kidney because it just wasn't working.
That sucks, yeah.
So when I see all of this and have had a couple of those, like breaks my heart that what is there to life?
Yeah.
Exactly. So that's the hardest part because when someone loses something, everyone has the kid to a pair of kidney.
Yeah.
And then someone has to struggle or someone is losing one of theirs, and it's kind of disappointing.
Throughout your career, what do you feel is the most valuable or significant thing you've learned so far?
Everything we have, I see it as a privilege because then things go downhill super fast for some people. Like I said, like someone who's young, I don't mean like a loose, like we have had patients in their 20s too.
Yeah.
You would expect just to live a normal life, but I used to tell people, like, just cherish what you have. It's not like I have to have two eyes, I have to have a working kidney, I have to have a working liver. No, people who have had it also, and then they don't have it anymore, or it's diseased and they have to live with it for the rest of their life.
Yeah.
A lot of things I knew now, maybe I wouldn't have known if I wasn't a nurse. That makes me cherish everything. Especially when I see someone like lose their life, be my patient or some of my colleagues' patient, and then we see they've been struggling a lot, and in the end they died. It's like, oh my goodness, what's it to life?
Yeah.
I'm coming from a religious perspective. I'm a religious person, so I'm like inclined towards whatever you have, see it as a privilege.
Yeah.
Your life especially, because it's fleeting. Nothing's guaranteed. Whatever you have, you should cherish it. Health especially, because you cannot buy that. Life is something to be cherished.
So what education did you take to become a nurse?
I went to the University of Ottawa. I did the Bachelor of Science in Nursing. Back home, I'm from Africa. I'm from Nigeria.
Oh, nice.
I studied food science and technology back home. I have a first degree from Nigeria. And back home, I've worked in food industries. I don't like people wasting food, so I thought, okay, food science could, change the perishable foods, make them, process them, something that's more formidable, something that lasts longer. That was what I did. But when I came to Canada, I never liked nursing back home, I have to be honest. I just didn't like the way things were being done. But when I came to Canada, I was pregnant with my son, my second child, and I had to be hospitalized. So I had this nurse. She's from Haiti. She speaks French. I'm from Nigeria. I speak English. But somehow we try to get along. Like, okay, we merci, bien.
Yeah.
And then I also saw when she left, like the nurses that took over, like everyone was just caring. Everyone was like, oh, how are you? Did you sleep good? Are you okay? Do you need anything? I saw that compassion. I saw like these people put everything of their being into this profession, and that makes a difference. So nursing isn't just about going and giving medication and giving injection and taking blood and do it. No, whether you like it or not, you have to bring your personality into this job.
Yeah.
You have to show compassion. You have to look at the patient from the holistic point of view, and you have to have compassion to be able to do this job. Because honestly speaking, I can tell you there are times you're so stressed, you're so tired, or some patients are very difficult. We have very difficult family members, and you'll be like, oh my goodness. Well, when you think of why am I here, and with every other job, all jobs are stressful, but of course some are more stressful than the others. So I saw this compassion, so that changed something in me. I thought, I think I can be part of this. And then when my child was like 2 or 3 years older, I went to school. And I did my full-time nursing study, and I've been working since then. And honestly, I enjoy every part of it. I'm very grateful that I went into nursing. I tell you, every day there's always a new thing to learn.
That's amazing,
There's
yeah.
always everything to share. Every day seems new.
In your career, like before you started, were there any expectations you had that were different from like the reality of nursing once you started working your job?
I can't say I had any expectations. Like I told you, I never thought I would become a nurse.
Yeah.
I didn't have anyone to inspire me. I can't really tell, I thought it was going to be this. This, no. I know from nursing school it's different, as a student.
Yeah.
What expectations from you are different from when you now have your license, have a higher degree of responsibility, a higher degree of accountability, a higher degree of integrity, which you may not have when you were a student.
Yeah.
I just go with the flow. Every day, like I said, it comes, okay. I just do my best, I do what I can do, and then look up for the next day.
Yeah.
That's it.
So then for you, what would you say you do to make a memorable impact as a nurse?
I don't know, I just think nursing, like I said, being there for people when they're in their most vulnerable state.
Yeah.
For me, that's the thing. That's a lot. I remember when there was a time there was this old lady. She's old, she's well, she's like in her 90s, I think, but she's still very much within it. Like she's student. Her neural senses are still intact.
Yeah.
So I was caring for her. Then she said, "Oh, my hair. So would you like me to give you a hair wash?" Oh, yeah. And then I just got some shampoo and then just something as little as washing the patient's hair. Oh my goodness, she was so grateful. She had to tell the nurse. Oh, she told someone, oh my goodness. Oh, she told my manager. She told my manager. And I didn't know she said anything to my manager. So much later my manager was, and then said, oh, by the way, so, remember the person who said she was very grateful you washed her hair. That made a lot of difference to me. Something as simple as washing your hair, it was, for me, it wasn't anything. It's just part of, okay, you want your hair washed? Okay. And I did it, and then, so it depends on the need at that time, what the patient wants, what's their need.
Yeah.
What are they craving for? Am I able to help in any way? Some, they just want something like they want coffee from Tim Hortons. Say, oh, okay, I'll see if I can get you a cup. And I get someone, do you want to buy my patient a cup of coffee? All these little things. So I can't say there's something specific, but taking care of people and coming back home fulfilled, coming back home, I think I did my best. For me, that's a lot. I think I make an impact in that little way.
That's amazing. What makes an excellent nurse, and what advice would you give to someone wanting to become a nurse?
First, you have to become passionate. You have to have passion for what you're doing, and you have to have empathy. Like I said earlier, whether we like it or not, if you're going to be a nurse, you bring your personality into the job. If you're the type that's not altruism is something everyone should have, but not everyone would have it. Yeah. You have to have you have to have that capacity to make an impact by helping this person. You cannot be a good nurse without having compassion. Yeah. You cannot be a good nurse if you don't have empathy. Because like I said, you kind of put yourself in someone else's shoes and say, wait, if I were in this position, what would I have done? Would I have coped better? Do I want to be in this situation? And people have different things people are coping with in life. So you have to be able to meet your patient or meet somebody at the point where, okay, not taking whatever they're going through for granted, and being compassionate in general. I would say that's the most important thing anyone should have if you want to be a nurse. You should have compassion.
We have some student questions. So the first one is, what made you choose nursing over other careers in healthcare?
Oh, I answered that earlier.
Yeah.
The way the nurses were taking care of the patients, and then we, particularly the nurse, the Haiti nurse, I don't think I remember her name. She doesn't speak English. I don't speak much, but somehow we tried it. I've had situations where I had to use Google Translate. Yeah. To also communicate with my patient. I just see this person is trying to do her best, and I sense, I perceive it. Okay, she's truly compassionate. She truly has a sense of I want to care for this person. And I saw it in some other nurses too. So I thought, okay, yeah, why not?
Are there any times of year or holidays that are the busiest?
Oh, the flu season.
Yeah.
Winter, yeah. The busiest house.
And then as a nurse, do you find it difficult to watch shows like Grey's Anatomy or other medical and doctor shows?
Oh, no, not at all. And before I became a nurse, I don't really care about it. Once in a while, yeah.
Yeah.
Once I became a nurse, and then when I watch and then they're doing something, that's not how. Oh, that's just how we do it.
Yeah.
Because then you kind of like see yourself in that space.
Yeah.
And because I have an idea of, okay, yeah. And every opportunity I have, I relate like things in my environment, things around me. Like I mentioned, that when my kids are playing around, be careful. In the hospital, a lot of sick kids in the hospital, a lot of people, So like that, every day of my life, I see one thing or the other that brings me back to my profession. One thing or the other that makes me talk about nursing.
Mm-hmm.
And that's the beauty of I'm very grateful. I'm glad that I'm in this profession because it's something you can live. It's a lived experience kind of profession. It's not something on the abstract.
Mm-hmm.
You see it, you feel it, you have it, you can sense it. Yeah. So that's it.
Thank you so much to Mutiat Sogbade for that amazing interview. If you want to listen to this episode or others like it, you can listen here on CKCU 93.1 FM or wherever you listen to podcasts.